The problem we focused on for this project was chronic low back pain. To recap my movement history, I participated in Taekwondo for 8 years and danced in showcases for 4. In the 6th grade, I was diagnosed with minor scoliosis, and in 7th grade, I had my first experience with lumbar pain. I wore a brace for roughly 2 weeks and was afraid to move because I might have made the pain worse. When I got to high school, I danced in my school show choir and competed in show choir competitions. During my senior year, I was dropped on stage, injuring my left metatarsals, but I continued to dance on it. My back pain intensified during my senior year as well, and after seeing countless doctors, my pain was more or less under control. At age 20, I pushed fear of injury aside and allowed myself to dance in a musical. So, where did all of this pain start? Well, I believe it started when I fell down the stairs at my first job when I was 17 years old. I was put in an immobilizer brace, and due to lack of proper rehabbing, I felt pain in my ankle for upwards of 2 years. My next 2 jobs required frequent bending down and lifting, which I was most likely doing incorrectly. Over the duration of this project, I underwent bi-weekly physical therapy sessions, met with my primary doctor on numerous occasions, saw a chiropractor, and went to urgent care. During my sessions, my therapist instructed me to do basic exercises, including lat pull-downs, seated rows, and banded monster walks. After all of my appointments, my back felt worse than before I came in. I didn't know any better and assumed that I was supposed to be sore. In hindsight, the soreness I felt was more irritation of my sacroiliac joint, and what I needed to do was rest my back rather than rehab it. The beginning of my group's training program yielded similar results to those of my physical therapy sessions, so we regressed the program until we found exercises that didn't hurt my back. On November 9th, our regress training program resulted in me, for the first time in 4 years, not feeling any lumbar pain. Even when I take pain medication, I still feel some type of slight irritation, but after that workout, I felt nothing. Primary doctor about my back. He prescribed me naproxen and put in a referral for physical therapy. On October 26th, I met with my primary doctor again to discuss my progress. I relayed to him that the sessions were not helping and were in fact making my back feel worse. He then prescribed me hydrocodone, recommended that I continue on with my physical therapy, ordered an x-ray, and referred me to a specialist. I took the hydrocodone for 3 to 4 days, then stopped due to fear of the medication's addictive nature. The x-ray showed a compressed space between my L5 and S1 joints. On November 9th, I saw a lumbar specialist about back pain and newly developed nerve pain in my legs. He suspected I had a bulging L5-S1 disc and changed my medication to Nabumetone and ordered an MRI of my lumbar spine. I took the new medication for 2 weeks to no avail. On November 11th, I saw a chiropractor who told me that my hips were different heights. My right hip is about an inch higher than my left, which can help explain the location of my back pain. On November 15th, my back pain got so bad that I had to go to urgent care. There, I got a shot of anti-inflammatories into my hip, was prescribed muscle relaxers, and then sent on my way. I got the results of the MRI a week and a half later and was told that it showed no significant abnormalities, ruling out a bulging disc and leaving me with no explanation. The specialist put me on nerve medication and diagnosed me with lumbar radiculopathy. As of now, I am taking the nerve medication at night as needed for pain, have been on medical leave from work, and other than when I'm at school, I have been on bed rest and am doing significantly better.
Throughout the entire training exercise program, there was a common reoccurring issue of Lyss going into hyperlordosis and relying on her IT band way too much. Her left side was commonly much tighter and more painful for her. Many of the exercises were much more difficult for her to do on the left side when compared for the right side. It seems all the muscles on the left side were a lot tighter than those of the right, however both sides were still very tight. There are many days that we were not able to do the workout due to Lyss's increasing pain levels, and we had to eventually develop a plan that was seriously reduced and regressed. We began Lyss's program way too ambitious and underestimated her level of pain. We started with intensive strength training, focusing on strengthening her glutes and lower body overall. This was our mistake, because as we learned later, Lyss was severely lacking in flexibility and core strength needed in order to complete the exercises correctly. During our first training session, almost every exercise needed to be modified to either lower weight or lower reps. Lyss tried to power through and work through the pain she had, despite our protests, but some exercises even she could not complete because she was in too much pain. We immediately began to regress the entire program and take out some exercises completely. We still focused on training her glutes and getting them stronger, but we wanted to focus more on stretching as well. Due to her pain levels, we decided to drop all the strength exercises as we realized that they only sometimes helped, and more often than not, the exercises would just cause aggravation to her back. The pain also depended on what she was doing throughout the day as well, but it seemed that the workouts we did were definitely not helping. We decided that there was no point in trying to strengthen if it was just going to cause more pain. Instead of having Lyss perform strengthening exercises, we decided to focus on alleviating pain as much as possible through stretching and a few very minimal exercises. We worked to try and loosen up as many muscles and reduce tension, especially in her back. Our plan included stretches that worked the main muscle groups and joints of the lower legs, as well as hypolordosis stretches. Our first attempt of the new plan went a lot better. Lyss would ride the bike, do some heel slides with core bracing, perform single leg raises with core bracing, and diaphragmatic breathing along with her stretches. We continued to use the bike because it did not give Lyss any pain, and it was a good way to get her muscles warmed up and accustomed to movement. The purpose of the thoracic abdominal bracing was to train herself to hold her body without using her back as compensation and to try to prevent herself from going into so much hyperlordosis in everyday living. We found that by forcing her to tighten her core, she had to use the correct muscles and could not rely on her back nearly as much. If we had more time, we would have advanced the movements to be more functional and work on trying to ensure Lyss would not continue to rely on her compensations. We chose to do the core bracing because any direct core exercises would cause her pain. This ruled out planks, rollouts, bird dogs, and quite a few other core exercises due to her hyperlordosis. However, the core bracing did not always work because Lyss's core was simply too unaccustomed to performing any supporting work on her back, and it would cause her to compensate by going into hyperlordosis, which also led to immense pain. We reduced the exercise plan once again and focused only on stretching in the hopes that we could prevent pain, and eventually maybe we could work up to strengthening and movement exercises. We could not do any stretches that might involve her back possibly going into hyperlordosis. This ruled out many quad stretches, back extension stretches, hanging stretches, and anything that would lead to an anterior pelvic tilt. The stretches we did end up using focused mainly on loosening up her back and stretching her posterior thigh muscles. We realized too late that we should have been including the psoas work to pull her into a little spinal flexion and posterior pelvic tilt to try and fix the hyperlordosis. The single leg raises and heel slides also helped to give a little bit of stretch to the hamstrings, which needed to be loosened up. Along the same vein, the diaphragmatic breathing training was to attempt to have her to breathe correctly in everyday situations and focus on not using as many incorrect muscles. Even though we were focusing on stretching primarily, we kept the 5-minute bike ride in the curriculum because it didn't hurt her and it was still a good way to get her hips mobile and warmed up. By focusing on stretching, we were able to give Lyss some release from the pain. As a few weeks went by, and Lyss's pain either remained the same or lessened, we decided to add dead bugs to begin strengthening her core. The dead bugs were great for Lyss because it forced her into a posterior pelvic tilt and got her to finally create a neutral spine without pain. Lyss was able to do 3 sets of 20 seconds without any back pain, which was a huge accomplishment considering how everything and anything had hurt her before we began our workout plan. We continued stretching, plus a dead bug method of training for the rest of the time period, which was only a week. The new program helped alleviate her pain for longer periods of time, and she was able to move better in everyday situations.
For the most part, every FMS test remained the same, if not similar. She had most of the same compensations, such as relying on her TFL, going into hyperlordosis, and hypolordosis. The only difference was that throughout each of the tests, Lyss did not feel any pain, even in the cobra pose. The only FMS test that changed was the trunk stability push-up. In the original FMS test of the trunk stability push-up, Lyss did not push up as one unit. Her arms pushed her shoulders up first, and then the rest of her body followed. During the final FMS testing, Lyss was able to complete the trunk stability push-up without any lag or compensations. Even though Lyss did not do a great job on the FMS test, she was able to increase her score from 11 to a whopping 21. Lyss did end up getting some more flexibility in her dorsiflexion. We think this was a big factor in relieving her pain because her muscles were not as tight as they were originally. This ties back to the joint-by-joint approach because her joints are now moving in the proper ways they should. Her ankles are substantially more mobile, which most likely made her knees more stable, her hips more mobile, and so on and so forth up through the entire chain. Therefore, our strategy of performing more flexibility type movements rather than strengthening movements for her ankles worked in her best interest. On top of that, she had a great amount of rest throughout the duration of our program, which prevented her from causing more damage than was already present. With the increased dorsiflexion flexibility, she was able to score higher than the previous FMS test. She was still able to complete her movements with very slightly less compensation and zero pain. Previously, Lyss would have constant pain, which would lead to an increase in muscle activity and spasm, which resulted in even more pain. By currently having no pain at all, Lyss finally made break out of the vicious cycle of pain.
Lyss was a very difficult case to rehab. She had so many issues stemming from a multitude of injuries, and it was hard to focus on just one pathology because they all affected each other. Lyss had so many muscles that were tight, not working correctly, or just plain not working, which made it incredibly hard to create a plan for her that would not cause pain at all. Even Lyss's various doctors and physical therapists were stumped on what was wrong and how to treat it. Overall, the only things that seemed to work was bed rest and stretching. The dead bugs helped much later on in the training. These were the only things that did not cause pain and actually helped her feel better for a period of time after.